Good morning, good afternoon. My name is Paula Brown, and today I will be giving a group introduction on elderly care in the United Kingdom. Elderly care has become an increasingly important issue as the UK population continues to age, with more people living longer and older adults needed support to maintain their health and independence. Understanding how elderly care works is essential. We will explain what elderly care means, the different services it includes, and the key challenges affect how it's delivered across the UK. I will talk about the content and definition. Elderly care refers to a range of services that support older adults with daily living health needs and independence. It includes home support, community services, residential and nursing home, and medical care. The UK aging population has increased demand for health and social care services. Many older adults now living with long-term condition and require ongoing support. Care is delivered by the NHS, local authority, private providers, and unpaid carers. Financial pressure, staff shortages, increasing demand create major challenges. Elderly care play a crucial role and improving is essential for supporting older adults with dignity and independence. Thank you.
Demographics and demand. England's population is changing rapidly, and these shifts are already shaping the future of adult social care. One of the most significant trends is the aging population. The number of people aged 50 and over is already around 22 million as of 2024, and this is projected to grow by around 19% by 2044. That means million more people potentially needing support, service, and age-friendly communities. Within that broad group, the fastest growth is among older age brackets. The population aged 65 to 79 is expected to rise by around 30% over the next 40 years, and the number of people aged 80 and over is set to more than double, reaching over 6 million. This is a positive reflection of longer life expectancy, but it also brings major challenges for health and social care system. Alongside these demographic trends, we're also seeing increased levels of loneliness and social isolation. Around 7% of the people aged 65 and over say they often feel lonely, and this estimated 270,000 older adults go a full week without speaking to friends or family. Loneliness isn't just an emotional issue. It has a real impact of physical and mental health, driving higher demand for support services. These projections underline why planning for the future is so critical. As the number of older adults grows and as more people live longer with complex needs, the demand of care, community support, and preventative service will rise sharply. Understanding these trends now helps us ensure that the system is prepared for the decades ahead so that people can age well, stay connected, and live independently for as long as possible. Policy and legal framework. In England, adult social care is shaped by a framework of legislation designed to protect people's rights, support well-being, and ensure that services work together effectively. At the heart of, of this framework is the Care Act 2014. The Act establishes the well-being principle which means that every decision taken by local authorities should promote an individual dignity, independence, and quality of life. It also places a strong prevention duty on councils, requiring early intervention to reduce or delay the need for care. Under the Act, adults and carers have clear rights, so assessment and support, and local authorities must provide accessible information and advice so people can make informed choices. More recently, the Health and Care Act 2022 has reshaped the system by putting integrated care system on a statutory footing. This formalized the rules of integrated care boards and integrated care partnerships, signaling a shift away from competition and towards collaboration. The aim is for the NHS, local government, and wired partners to work together to improve population health, reduce inequalities, and provide more join-up care. Another important change is the introduction of CQC system assessments of ICSs. For the first time, the Care Quality Commission is able to review how efficiently whole system, not just individual providers, are performing. This strengthens transparency and accountability, which while also encouraging local areas to focus on taking health and care inequalities across the populations. Together, these policies and laws create a clearer, more person more person-centered foundation for adult social care. They emphasize prevention, integration, and fairness, helping ensure that people receive the right support at the right time and in the right place.
Hi, my name is Gulnaba Takayo. I studied Suffolk University, Health and Social Care. Today I want to talk about how care being delivered across the system and the different models that are shaping a more responsive. A lot of the focus now is on supporting people in their own homes and communities. Services like domiciliary care and resettlement are key to this. They help people stay independent, rebuild confidence after illness or injuries, and avoid hospital admissions that don't need to happen. In many ways, they're that front there of personal and preventive care. Care, community health services, and pharmacy are also central pillars. They offer easy to reach advice, treatment, and long term conditions management, which helps reduce pressure hospitals and keeps people closer to home. We are seeing more teamwork across organizations now, which makes care more coordinated and approached. Intermediate care is another important part of the system. Home first models and step up, step down pathways help people move smoothly between hospital and home, recovering in the right place and avoid delays that affect both the patients and the wide system. Urgent community response, a great example of timely support making a real difference. The 2 hours UCR models provides fast help for people in crisis at home, preventing ambulance call-outs or hospital admissions when they are needed. We also can't overlook the contribution of the voluntary and community sector, along with unpaid carers. They offer support, connected advocacy that formal services can always provide it, and they're vital part of people's well-being. All these models work together to create a more integrated and flexible system, one that comes to give people the right care in the right place at the right.
Today, I also want to reflect on the latest messages coming from the Care Quality Commission's State of Care Report for 2023-2024 and 2025, and also what they mean for our health and care system. The findings are clear. Service continue to face significant pressure, whether in the hospitals, primary care, social care, or community services. Demand is rising faster than capacity, and this is placing real strain on the quality and safety of care. One of the most concerning terms is the ongoing verification in both quality and access. Today, I want to talk about one of the most critical challenges facing our health and social system. Our workforce across social care, we are seeing persistent vacancies and high turnover. This gap don't just create pressure on our service, they directly impact of quality, continuity, and safety of our care recruitment retention are becoming increasingly difficult without a stable workforce. The entire system of struggles to meet raising demand at the same time. The skill required within the sector are challenging. We are seeing a clear shift towards community-based care, rehabilitation, and supporting people living with complex long-term condition.
Hi, my name is Nicholas Kikabi, and I'm here to discuss about the challenge and the gaps in elder care in the UK, and how these issues help to shape the quality that the adults receive, and why, and also help us to understand why it's necessary to have these reforms and innovations to address the problem. I'll start with the high demand, which is doesn't match the high demand and low capacity. This is a result of the over-aging population in the UK, which requires more support. Yet the availability of beds and home care packages is very limited. Hence, long waits for patients and adults to be discharged from hospitals. I also want to add on to the challenges of workforce shortage and low pay. People are leaving the industry to join other industries for better paydays, as they're struggling with the low pay in the elder care sectors. There's also a problem of housing, which which does not adapt to the needs of older people, especially those with mobility issues. There's also another problem of loneliness and social isolation. This has also had an impact on both their mental health and physical health. Due to all these challenges and gaps, it's important to understand that the reforms and innovations are necessary. So moving on to reforms and innovations, I want to address that. There've been an introduction of care. What do you call that? Care. There've been integrated care systems that ease the path from the hospitals into homes. And also there've been introduction of care dictator systems that helps the GP hospitals and nurses to share information. Also there have been virtual wards that help clinicians to monitor their patients while they are at their homes, and also there's also been rapid community response. So to summarize all this, I would have to say that there's a lot of challenges facing the elder care industry, but the reforms and innovations are helping to ease that problem. Thank you.